We got urinary system here. Urinary system and reproductive system, obviously a little bit of crossover because of what they share to get rid of it. So some structures are here on the urinary system that are reproductive in nature. And obviously on the reproductive structures, we can see some of the urinary structures, so I'll point all those out when we get to them here. Kidneys up here, where we make the urine. Ureters are what convey that urine to the urinary bladder right there. Urethra is what takes that urine from the bladder to the outside world. On this model here, I'll say it right here to begin with. This is the urethra. Okay, this is the urethra. The female and male urethra are different, and really they're different because of the length. Okay, so here's my bladder. This is the uterus. So this is the bladder. This is the urethra right here. Really short. Okay? For a female, we just call it urethra. For the male, because of the length, okay, we have, again, the bladder's right here. This travels through the prostate gland, so this is the prostatic urethra. This little red region right here, it's called the urogenital diaphragm. This little portion of the urethra that travels through there is called the membranous urethra. Okay, it's just, again, just this little bitty region right here. Okay, just that little bitty region right there. And then the portion of the urethra that travels to the penis, penile urethra. It's also called the spongy urethra because of the structure right here. We'll talk about that in the reproductive system. Okay. Again, here's my ureter right here. Okay. Where we form the urine starts up in this thing, which is that thing. All of these little circles right here. All of these little circles right here. Okay, so I've taken this and boom. Took that and boom. Okay. So if I go back here to the global view here, okay, where I'm forming the urine, I'm conveying it all towards this little bitty cup right here. All these are the minor calyx. Calyx means cup, okay? Small cup. Minor calyx, minor calyx, minor calyx, minor calyx. Where two minors lead to something bigger, there's your major calyx, big cup. Minor calyx, big calyx, okay? Or major calyx, sorry. You only have about 2 or 3 major calyces per kidney. And then renal pelvis and ureter right there. Okay. If I go over here, again, I've just taken this section, put it right here, okay? I have this little bitty red thing, which is this right here, okay? This little bitty red thing is the glomerulus. And I guess I could ask it there. I mean, you're seeing it there. But I mean, this is a lot better, okay? Surrounding it is that yellow structure right there. Glomerular capsule, so that's all of this thing right here. Fluids get pushed out into these tubular structures. The first one is right here. This is the proximal convoluted tubule. Closest to the glomerulus, proximal, convoluted, because it takes a bunch of twists and turns. Proximal convoluted tubule into the descending nephron loop, into the ascending nephron loop, to the distal convoluted tubule, putting that urine in the collecting duct, and that's what you see going down right here. And that is the urine. If we go right here, this right here is that same view. Again, that's the glomerulus. It's just a specialized capillary bed. Here you can see that proximal convoluted tubule. And when you look at it up close, you can see that these are simple cuboidal cells. And they have little hairs on them, microvilli. So it just tells you there's a ton of reabsorption occurring here. If we go and look at the distal convoluted tubule, which is up here, which again is just there in cross section, okay? Simple cuboidal cells, but no microvilli, so there's not a lot of reabsorption occurring here. Okay? But that's the distal convoluted tubule, that's the proximal convoluted tubule there. The last thing, number of blood vessels here. There's one down here that I don't have you know, that's the vasa recta. It's kind of important, but we'll get into it a little bit in lecture. But we have this little artery and this little artery. This one's big, this one's smaller. This one's going in, this one's leaving. Afferent arterial, efferent arterial. This is bigger, brings in a big volume of blood into the glomerulus. This is small, not as much fluid gets to leave the glomerulus, so that creates a back pressure here. And that is a major force that helps to push out a ton of fluid out into this glomerular capsule, shunt it down here, and then the rest of it is just we're reabsorbing or secreting stuff throughout the entire rest of this tubular structure. Okay. We throw out a ton of fluid here, and ultimately you only produce 2 liters of it, 1.5 liters of urine. And you're dumping out, hundreds of liters per day, and only produce 2 liters of it at the most that you get rid of. So there's a lot of metabolic activity here inside this little nephron structure. There's your urinary system.